Turmeric and blood thinners. That is our subject for today. So as a naturopathic physician and as the medical director at Up Wellness, one of my jobs is simply answering questions. And one of the most common questions that I get is from people who are taking blood thinners and they're wondering if it's safe for them to also take a turmeric supplement. Now, not only is this a really common question, but it's also an extremely important one. And there is a massive amount of misinformation out there on the internet and coming from doctors' offices and pharmacies themselves. So the question usually goes something like this. I take a blood thinner. Is it safe for me to add turmeric? I understand that when people ask this question, they are looking for a simple yes or no answer. But like many, many other things in medicine, it is just not quite that simple. Of course, when people are on a blood thinner that's prescribed by another doctor, my answer always includes the advice that they should talk to that doctor before adding any new supplement into their protocol. And yes, it is always important to do that. Unfortunately, the doctor on the other side of that conversation often knows very little about turmeric, and they will often give a person generic, I call it CYA, which stands for cover your you-know-what advice that is not rooted in a real understanding of the issues involved here. But if this is a question that's come up for you or for someone that you love, it's really important that you understand some of the science behind this so that you can be better prepared to have that conversation with your doctor or with your pharmacist. So with that, let's dig into turmeric and blood thinners. First of all, people use the term blood thinner to refer to a whole range of different medications. Interestingly, none of those meds actually thin the blood, but they do prevent it from clotting, and they do it in a few different ways. Most often, people are talking about anticoagulant drugs, and this is drugs like Coumadin, Eliquis, Pradaxa, Xarelto, heparin-based products. Those slow down the clotting process. And people also ask about drugs that are called antiplatelet drugs, and that's drugs like Plavix, Brilinta, and even aspirin has antiplatelet effects, and those decrease clot risk by preventing platelets from clumping together. So to keep it simple for this, I'm going to lump all these drugs together and just call them blood thinners to help you understand the potential interaction between turmeric and this whole family of different pharmaceuticals. First of all, turmeric can thin the blood a bit. Turmeric and curcumin is the most active compound that is in turmeric, have been shown to have mild to modest blood thinning effects. It's not exactly clear how this happens, but the effect appears to be related to both a combination of anticoagulation and antiplatelet effects, but the precise mechanism, like I said, is still being studied. Nonetheless, turmeric can make a person bleed more easily. There is not really any controversy about that. When a person is taking a blood thinning medication, there is usually a good reason for that. Generally, it's because that person is at an increased risk for developing a blood clot for any number of different reasons. This can be from cardiovascular disease, atrial fibrillation is a common cause, a recent surgery, or if they've had a previous blood clot, a range of other reasons. Regardless of the reason, it's serious business. And managing blood clotting risk is pretty tricky. It's a lot like a Goldilocks situation. Overly thick blood that clots too much or too easily, that's obviously a problem because you get increased risk of blood clots, and blood clots can kill people. But thin blood that doesn't clot enough, that's also a problem too. You don't want to cut yourself shaving and then bleed to death. That's where the concerns about turmeric come up. The concern here is that if a person is already taking a blood thinning medication and then they add another blood thinner, like turmeric, to their daily routine, theoretically, their blood could become overly thin. And that means that the risk of excessive bleeding goes up. Now, unfortunately, when it comes to solid scientific evidence from large human clinical trials about this potential interaction between turmeric and blood thinning medications, we are largely flying blind here. We know that turmeric or curcumin has a mild blood thinning effect. We know that blood that is too thin can be dangerous, but we don't really know if consuming turmeric in food or in the amounts that is normally contained in a supplement actually increases the risk of a bleeding event in people who are already taking various different types of blood thinners. There are a few case studies where turmeric may have been involved in excessive bleeding. No solid evidence here or clinical evidence that has proven an association between the consumption of turmeric and increased bleeding risk that is clinically significant. In other words, we simply do not know if turmeric and blood thinners are a very dangerous combination. It's possible. It's what we call a potential or a theoretical risk. But the question then becomes about how much risk any patient or any physician is willing to tolerate. And yes, that is a question that's to be answered between you and your doctor. Now, what many people have read or have heard from their doctors is that it is absolutely, strictly contraindicated, unacceptable, unsafe, or even dangerous to take turmeric while a person is on a blood thinning medication. And honestly, that's a little bit frustrating because the real answer is much less clear than that. It's even more frustrating because we also know from lots of studies that turmeric can be really beneficial for people, especially people who have musculoskeletal pain, which is the reason why so many people want to take turmeric. It's also worth pointing out, it's extremely common for people to take multiple medications that all have blood thinning effects at the same time. One of the most common examples of this is NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, for example, which are regularly used by people on blood thinners, often without any discussion with their doctor or their pharmacist, or even knowing that there might be an increased risk. Now listen, I would never suggest that you go against the advice of your doctor or of your own healthcare team, but if taking turmeric is of interest to you and you've encountered resistance in the form of that hard no from your doctor, it's important that you understand that the reality is a little bit more complex and nuanced here. Yes, you should absolutely talk to your doctor about turmeric and blood thinners. And if your doctor is open-minded, is willing to listen, is willing to review the available evidence, and to consider monitoring your coagulation tests. We have lab tests for this. That includes the PT, the PTT, or the INR if it's appropriate. You may be able to do an experimental trial of turmeric to evaluate, number one, if it helps you, and number two, if it affects your coagulation test or your bleeding risk in any significant way. And if you do that, you might discover that it's possible to have your cake and to eat it too, to find a risk and benefit ratio that you and your physician are comfortable with. I do not consider the potential interaction between anticoagulants and turmeric in food or in doses that is normally found in supplements to be an absolute contraindication. And as such, I encourage open and honest communication between you and your providers to help determine what is the best path ahead for you in your unique situation. I hope that this was helpful. And listen, if it was, hit that like button, subscribe to this channel, and click that little notification bell down there so you don't miss a thing.